A rectal tube, also known as a rectal catheter, is used to relieve gas or fecal matter from the intestines. It's employed when a patient has difficulty passing gas or stool naturally, or to manage fecal incontinence, the inability to control bowel movements. The tube is inserted through the anus into the rectum. Key uses: gas relief. For severe bloating or distension like post-surgery or ileus, the rectal tube helps release trapped gas. Fecal incontinence. For bedridden patients or those losing bowel control, the rectal tube diverts stool to a collection bag, reducing skin breakdown and infections. In some cases of partial bowel obstruction, the rectal tube may help relieve pressure in the intestines and provide comfort to the patient. For persistent diarrhea in critical care, rectal tubes help collect liquid stool, preventing skin irritation and maintaining hygiene. How it works? Insertion. The rectal tube is gently inserted through the anus after applying a lubricant. It's similar to placing a rectal thermometer, but the tube goes deeper. Connection to a collection system. The tube's external end connects to a drainage bag or collection system. This bag collects gas, stool, or diarrhea from the rectum. Length of use. The tube can stay in place for a few hours to several days, depending on the patient's condition and how much relief is needed. It's checked frequently by healthcare staff. Removal. The tube is gently and carefully removed when it is no longer needed or when stool can be passed naturally. Benefits: prevents distension. By relieving gas or stool buildup, the rectal tube effectively prevents painful abdominal bloating and pressure, providing comfort. Reduces skin damage. In patients with fecal incontinence, it reduces the risk of skin breakdown and infection by keeping stool off the skin. Aids in healing. For patients recovering from surgery, it can help reduce bowel stress, promote comfort, and allow for better healing. Risks and complications. The tube may cause discomfort or mild rectal irritation. Infection, small risk of bacteria entering the rectum causing infection. Tissue damage, incorrect insertion or prolonged use can potentially damage rectal or anal tissues. Conclusion. A rectal tube is a useful tool for managing gas, stool, or incontinence, especially for patients unable to pass gas or feces. It must be inserted and monitored by healthcare professionals.